This conference will now be recorded.
Hello, sir.
Hello, am I audible?
Sir, shall we start, sir?
Yes, yes.
Good afternoon, one and all. I once again welcome you all for the second session of the first day national level webinar, Nidana City 2022. Now I welcome Dr. Gopikrishna Acharya, sir. Sir, thank you so much for accepting our request as a resource person. Now I request Dr. Rajeshwari Madam to give the brief introduction regarding our resource person, Dr. Gopikrishna Acharya, sir.
Good afternoon to all. Welcome to Nidana City, a national webinar from the Department of Roganidana, Vigyana. It gives immense pleasure to welcome Dr. Gopikrishna Acharya, sir, presently working as a professor, Department of Roganidana, evum, Vikriti in SDM College of Ayurveda, Hassan. Sir, working as a Dean Academics, Interns Training and Placement. Sir, sir has completed UG in RHS in the year of 2002 and PG Government Ayurveda College, Kannur in the year of 2006 from Kannur University. Sir also completed PhD under the valuable guidance of Dr. G. Srinivas Acharya, sir, in RHS, Bangalore. Sir also having a 15 years experience in the teaching field. Sir also awarded as a favorite teacher in SDM Udupi College in the year of 2008. Sir also awarded as a best teacher in the year of 2021 at SDM Hassan. Welcome you, sir, and I requested to sir to continue the session.
Am I audible?
Yes, sir.
Okay. Mukam karoti vacharam pangum lankhayate girim yatkripatamahamvande paramanandamatham. Agartha viva sampraktau agartha pratipate jagatah pitarau vande parvati parameshwarau. Guru Brahma Guru Vishnu Gurudeva Maheshwaraha Guru Sakshat Parabrahma Tasmai Shri Gurave Namah. Salutations, offering my salutations to Almighty and all my teachers. Good afternoon to one and all. First of all, I convey my sincere gratitude to the organizers of Nidana Siddhi, Principal Dr. S.V. Gaddihalli Shetty, Vice Principal Dr. Adivesh Rakeri, Dr. Samir Naik, Professor and HOD, Department of Roganidana Vikriti Vigyana, and Dr. Anil Kurangi and Dr. Ashwini Kudrimat, Department of Roganidana and Vikriti Vigyana, and all other faculty members and all dear delegates of Nidana Siddhi. So, let me give you the brief outlook on the Avarana. Actually, the topic given to me, it was just like the to describe the boundaries of a galaxy. That is very difficult to say. To give the exact meaning of it in a short span of 1 hour. But still, I would like to give a possible explanation, which could be considered to be a tip of an iceberg, wherein 95% of the ice is present immersed in the water itself. So here, an attempt is being made to know about the physiological as well as pathological plus clinical understanding of Avarana. So when you look into the Avarana, so here, first of all, let me split the concept. And by splitting the concept, it will be very simple to learn the concept and its current understanding. And the after that, the probable link between the Ayurveda and Western concept. So this is the what do you say hallmark of today's presentation. So regarding the term Avarana, when you look into the Avarana, which is having three different textual descriptions. One that is Achadana, second one that is Gatihanana, and third that is Vega Pratibandha. So these are the three different terms you may get in the texts as such. But when you look into the exact word meaning, so it could be obstruction, and or otherwise it could be even covering also or encircling, and it could be even the encapsulation, and it could be a barrier, sometimes concealing or hiding. So these are the different meanings you may get when you hear the word Avarana. So this particular Avarana, so let me give you the explanation with one particular small concept in terms of circulation, which is available in the present day Western physiology. So wherein the circulation, the main part of the circulation is happens in the capillaries. In the capillaries, the main thing that is responsible for the movement, etc., that is by the water, proteins, and electrolytes present in the capillaries. So these are responsible for the certain movement of the nutrients as well as metabolites across the capillary membrane. So here the water portion, so that is actually responsible for the movement of the any of the substances from the capillary to interstitial space. That is what is called the hydrostatic pressure. And the one which is responsible for the movement of the fluid from the interstitial space to capillary, or otherwise preventing the movement of the uh, fluid, etc., that is osmotic pressure. This is being exerted by the proteins as well as electrolytes. Both of these, so all these can be described under the heading of Stirling forces. Before going into the actual term Stirling forces, let me give you the overall eye view in what do you say that the blood vessels and its functions as such. When you look into the blood vessels as such, extreme left as such, you have the picture that is showing laminar flow and turbulent flow. So when you look into the laminar flow, so that is the center, usually in the blood vessel, usually RBCs they will be present, and on the periphery, that is the WBCs will be observed, and extreme periphery, it is the serum or the fluid portion that will be moving in the extreme periphery. This is what is considered to be the trilaminar blood flow. Whereas if there is any kind of the obstruction is being present, so this is what is considered to be responsible for the turbulent flow. So this is what is considered to be the turbulent flow that can happen. So in this particular, the smaller below image on the extreme right side, so there is again the two more images, laminar flow and turbulent flow. The turbulent flow that will be observed for the partially, further that will be continued with the laminar flow. So that is depending upon the area of obstruction where there will be happening because of the one, what we can say, that is the concept of dhamani pratichaya, etc., which is considered to be one of the the pathological finding. That is what is considered to be siragranthi. Regarding the another picture that shows regarding turbulent flow, so this will be the nature of a turbulent flow. So no proper, the what you say, that direction of the fluid that will be happening if there is any kind of the avarana that's happening there. This is what is considered to be turbulence that can happen if there is any kind of the obstruction that is going to take place. This is third image where we are going to see the, what do you say, that the, if there is any kind of the thrombus formation, so that is resulting in the again turbulent flow. So that is no proper, there may be a possibility even reverse movement, and there will be a possibility of total change in the movement that will happening in cases of the any kind of the avarana that is happening there. So here there are two terms are there, avaraka and avrata. So avaraka is the one which is considered to be responsible for the obstruction there. So here, that is why the thrombus that is being mentioned here, that could be considered as avaraka. And the one which is being obstructed, being obstructing the movement of this, that is what is considered to be avrita. So avaraka is the one that is the cause, and avrita that will be the effect. Coming to the Stirling force that I have described earlier. When you look into the Stirling forces, so this is the concept that is being mentioned in the Western physiology. Usually that happens at the capillary level. When the blood pressure is 120 by 80 millimeter of mercury, that is usually a normal phenomena. So that will be responsible for, there are the pressure as such, the different pressures at the capillary level. So here there is a red colored image that is considered to be the hydrostatic pressure, which is considered to be responsible for the movement away, whereas the green colored image, that is preventing the movement of the fluid away. So here, when you look into this particular aspect, at the arterial end, hydrostatic pressure will be something around 32 millimeter of mercury, whereas oncotic pressure at the arterial end will be around 25 millimeter of mercury. And this particular high oncotic pressure or osmotic pressure that will be maintained throughout, that is even at the venous end also, the oncotic pressure will be something around 25 millimeter of mercury, and hydrostatic pressure at the venous end, it will be around 12 millimeter of mercury, whereas the hydrostatic pressure and oncotic pressure that will be even present in the interstitial spaces also. So the hydrostatic pressure in the interstitial space, that is being termed as tissue tension, that is being mentioned as TT, tissue tension. So that is 4 millimeter of mercury will be the what do you say, that measurement for the hydrostatic pressure at the interstitial space, whereas oncotic pressure at the interstitial space will be something around 8 millimeter of mercury. When you look into this particular arterial end, hydrostatic pressure and oncotic pressure, they will be occurring simultaneously. So if there is arterial pressure, all these, they will be acting simultaneously. That means the hydrostatic pressure and oncotic pressure of the capillary and hydrostatic pressure and oncotic pressure of the interstitial space, they will be happening simultaneously, whereas at the venous end, the same, all these that will be happening simultaneously. So let me draw this in that particular situation. So this will be, is it visible?
Yes, sir.
What point? Okay, okay. So in that particular situation, so let me conclude in this. Let me say overall on the arterial end. When you look into this particular arterial end, when you sum up the total pressures, 32 millimeter of mercury plus 25 millimeter of mercury. So why here the minus came? That is because of its reverse direction. So that is why totally when you look into this particular image, so something around 7 millimeter of mercury will be the total amount of pressure that will be observed at the arterial end, whereas the interstitial space, it is something around plus 4 millimeter of mercury, 4 plus minus 8. So that is minus 8 came because of the abnormal, sorry, in the reverse direction of tissue tension. That's why minus 8 came. That means in total 7 plus 4, 11 millimeter of mercury will be the amount of pressure that will be acting at the arterial end. So wherein the movement of the fluid will be taking place, nutrients will be taking place from capillaries to interstitial space. When you look into the venous end, so that is what is considered to be the 12 millimeter of mercury is the hydrostatic pressure and 25 millimeter of mercury is the oncotic pressure. When you add both of these, it will be something around minus 13 millimeter of mercury, and the oncotic pressure and tissue tension at the interstitial space will be the same. So that is plus 4. That is in total minus 13 plus 4. That is around minus 9 millimeter of mercury. With this amount of pressure, so movement of the fluid or metabolites will be taking place from interstitial space to capillaries. Suppose if there is any obstruction is being taking place somewhere in the here, somewhere in the here, what actually happens? So here the natural direction will be from the arterial end to venous end. So it will be like that only. But where there is any kind of the obstruction, that will bypass. So this will be the nature of direction of the fluid, etc., that will be taking place, bypassing this particular the area where there is obstruction is there. If there is obstruction to a much larger extent, see, this will again bypass the the obstruction. That is what actually what we can say that could be a Siragranthi. Suppose here the obstruction is there. Earlier it was something near the arterial end. So here when you look into the venous end, what actually happens is, so movement will be taking place here, but again because of the larger obstruction that will move in the reverse direction. In the sense, the hydrostatic pressure will be increased. So that means more and more fluid will be moving from capillary to interstitial space. Capillary to interstitial space, there is movement of the fluid will be taking place. Further, if there is complete obstruction, what actually happens is, so there is no movement at all. So here that will not be any kind of the pressure difference may not be there, but here the pressure difference will be to the maximum extent. So that means more amount of hydrostatic pressure, more amount of hydrostatic pressure in the sense there will be more amount of the movement of the fluid that will taking place from capillary to interstitial space. So here, so this is what is considered to be a concept of microcirculation. When you look into the concept of microcirculation, what actually if there is any kind of the obstruction, so that will be taken up by the adjacent capillaries. So let us say next image, suppose if there is any obstruction is being taking place here. So the yellowish colored, the you are going to look into the Srotorodha there. What actually happens? So here there will be no movement of the fluid taking place distally. But what actually happens is there will be the movement of the fluid will be taking place from the other side. That is what is called a preferential channel. There will be the movement, and the blood or the capillaries, they will be taking the what is that the cells from these preferential channels. So there will be the nutrients, they will be getting into this particular cells as such, not this particular area, because as there is obstruction is there. So because of that, that will be taking place from the different side. That's why, so if the obstruction is small from any part of the body, etc., so that will be taken care of by the collaterals. Next, regarding the concept of rogamarga here. So let me give you the concept of rogamarga. So this will be helpful in understanding the Avarana even much better. So when you look into the rogamarga, the as such, so that can be divided into 4 different compartments. First of all, that is gastrointestinal tract. So then comes the intravascular compartment, then comes the interstitial compartment, then comes the intracellular compartment. When you look into the gastrointestinal tract, what actually happens is, so the food that we are going to take, so that will be completely digested. So that will be happening, that is the macronutrients will be converted into micronutrients. So these micronutrients will be getting absorbed from the alimentary canal into the blood vessels. That is what is considered to be intravascular compartment. From then it will be entering into the liver, and then enter into the heart, and then enter into the different channels. From there it will be entering into the capillaries. From the capillaries it will be entering into interstitial compartment. And from the interstitial compartment, what actually happens is that will be moving into the cells. That is what is called intracellular compartment. And this particular intracellular compartment is present even inside the bones. That is what is considered to be the intracellular compartment of the bones. The thickness of this intracellular compartment inside the bones is much more thicker than intracellular compartment of the other body tissues as such. So this is what is considered to be the understanding. Now how we are going to apply this into the disease manifestation? We know that all the diseases are considered to be because of mandagni, and this particular mandagni and is considered to be responsible for the, what do you say, that the entry of pathogens into the body. And this particular pathogen or antigen is nothing but the proteins. And when you look into these particular proteins, so there will be proliferation of proteins will be taking place in the alimentary canal. If there is more amount of the proliferation or the increased proteins, that will be entering into the intravascular compartment through the diffusion process. The diffusion process is nothing but the movement of the any of these substances from the higher concentration to lower concentration. This is what is called the this is what is called the diffusion. And as the more amount of the pathogens are present in the alimentary canal than the intravascular compartment, that will move from the alimentary canal into the intravascular compartment. From there, as we have mentioned, it will be entering into the liver, it will be entering into the heart, and it will be entering into the capillaries. From there it will be entering into the interstitial compartment. From there it will be entering into the intracellular compartment. And if the disease is much more severe, so that will enter into the even into the intracellular compartment of the bones also. This is what is called a madhyama roga marga there. And when you look into this particular part, so this particular alimentary canal, that is being considered to be koshtha or abhyantara roga marga. When you look into the compartments, that is intravascular compartment, interstitial compartment, and intracellular compartment, that is considered as bahya rogamarga, and intracellular compartment of bones, etc., that is considered to be madhyama rogamarga. So this is what is considered to be the total the understanding of rogamarga there. Now, if there is any avarana is happening somewhere here, so here this is what is called the avarana in the gastrointestinal tract. If there is any avarana is happening, what actually happens is on that particular avarana there is no movement at all. So the movement will be bypassing this particular avarana that is happening there. So this is in relation to alimentary canal. This may be the possibility. So here this could be avarana in the alimentary canal. So that means there is a ama formation. So this ama acts as a avaraka there, and that is responsible for the bypassing this particular obstruction there. Then, so next comes regarding the avarana that could be happening in the intravascular compartment. So that is somewhere at the what we have discussed at the level of the interstitial compartment as well as intravascular compartment. If there is any obstruction is being happening, that is what is called a sira granthi. In that particular situation, so there will be a bypass of what do you say, the bypassing that will be taking place from this avarana there. So sorry. Now, when you look into this particular cause in terms of the image, so there may be a possibility of obstruction. Am I audible?
Yes,
There may be a
sir.
possibility. Okay, madam. Okay. So there may be a possibility of avarana in the alimentary canal. So this particular whole the strip, the blue color strip, could be alimentary canal. There may be a possibility of obstruction somewhere here. There may be a possibility of obstruction somewhere here. In both these occasions, so the clinical manifestation will be happening in relation to these two organs only. And this could be suppose if there is any kind of the obstruction that is happening somewhere at this particular level, what we can say there could be movement on the either sides. That is any kind of the pathogens that will be moving into the exterior. Further, that will move into the different body parts. So here the whatever they may be the pathogens are there, so that will be moving into this particular periphery from the center. So why, so how this particular concept can be derived, that is rogaha sarvaipamandegnav, and pathogens that will be present inside the alimentary canal, that is going to get proliferated, and that's how this proliferation of these that will move into the intravascular compartment and interstitial compartment, and from there into the intracellular compartment with the simple diffusion process there. And regarding the location of avarana, so that actually the clinical manifestation that happens because of the different location of avarana there, and the clinical manifestations or clinical features may vary. For example, there is a green colored one, so that is could be an area of Pakwashaya there. And if there is any kind of the obstruction that is happening or avarana is there, there may be a possibility of any kind of the clinical features of intestinal obstruction that you can observe. And in the chest, if there is any kind of the avarana is there, there is a possibility of what do you say, the clinical manifestation in terms of IHD, maybe the angina pectoris or maybe the myocardial infarction that can be observed there. And if there is any kind of the obstruction happening somewhere at this particular periphery, there may be a possibility of brachial plexus injury, etc., that can happen there. So next, regarding the another major concept, when you look into this particular the avarana, that you can able to understand even much better. So let us take, this is an image of a srotas which contains 5 different points. Point number 1, 2, 3, and 4, and 5. And it has 2 ends, A and B. When there is any kind of the obstruction at the point 1 and point 2, the clinical manifestations can be observed early at the point A. So when you are getting the obstruction somewhere at the point 4 and point 5, then clinical manifestations are observed at the point B. And if there is any kind of the obstruction at the point 3, the clinical manifestations may be observed depending upon the pathogenesis, where it is moving, point A or point B. Suppose if there is any reverse peristaltic movement or reverse movement is happening, you may get the manifestations at the point A. And if there is a normal course, maybe 4 or 5, then you may get these symptoms at the point B level. So then am I audible? Am I audible?
Yes, sir. Everything is clear, sir.
Okay. Just a minute. Just a minute. Okay. When you look into the concept of avarana, suppose, so let us take the concept of anyonya avarana here. What do you say anyonya avarana? Let us say this is an image of respiratory tract. When you look into this particular image, so there are basically two types of the vata they are going to act there. One, that is a pranavata. Second one, that is the udanavata. When you look into the pranavata as such, so that is responsible for the movement of the any kind of the air inside, whereas udanavata is the one that is responsible for the movement of the air outside to the exterior. In that particular sense, so when you get any kind of the obstruction somewhere, let me say, somewhere in this particular level, just a minute, in this particular level, you may get the more amount of, what do you say, that the udanavata dushti than pranavata dushti. Suppose if there is any kind of the obstruction somewhere at this particular level, we may get the obstruction, the movement of the pranavata is being afflicted there than udanavata. So if the any kind of the obstruction is at this particular level, so pranavata will be afflicted than udanavata. But here the difference between this one and this one is specifically, even the person may have the discomfort even in relation to food intake also. So in this image, food intake may not be afflicted much. It is the what do you say, that the air movement that will be afflicted there. So this is what is considered to be the concept of anyonyavana that you need to think of. And concept of anyavarana, how we are going to look into the anyavarana concept here. So here let us discuss mutravrutavata. Mutravrutavata, so description says mutra pravrittiratmanam bastau mutravrute anile. So when you look into this mutra pravrittihi, first of all, mutra pravrittihi, that is there will be the absence of what is micturition. So this will be followed by bastau atmanam. So that means distension of the lower abdomen. So here this is an image, so which is considered to be specifically indicative of a distension of abdomen, that is specifically due to mutravrita vata. That is mutra, the what do you say, that the obstruction. How we are going to identify? So there is one small image is there. So that is what is considered to be direction of umbilicus. We can able to predict. When you look into this direction of umbilicus, it is in the upward direction. When there is any kind of the direction that is of the umbilicus in the upward direction, that indicates the swelling in relation to lower abdomen, and it is considered to be due to mutra apravritti, because so that will be central suprapubic swelling we may get able to identify there. So this is the one of the understanding of a mutra avritavata. So here there is another small image that is being mentioned there, so wherein there will be a probable obstruction that can happen, so which in turn results in the mutra apravritti followed by excessive retention of urine. This is what is considered to be happening here. Then comes the one more term, that is varchasavritavata. So that is purushavritavata. So here what actually happens is varchasoti ubandhoda svesthane parikrantati prajatyashu jaram sneho bhukte chanahyate narah चिरात् पीडितमन्नेन दुःखं शुष्कं शकृत्सृजेत् श्रोणिवंशनपृष्ठेषु गुरुग्विलोमश्च मारुतः अस्वस्थं हृदयं चैव वर्चसा त्वावृते निरे. So here what actually happens is, if there is the avarana happening because of the purisha, what actually happens, first of all there will be more amount of the what do you say, that the amount of fluid portion that is going to get reabsorbed from the fecal matter. So that means that the fecal matter will become much more solidified, which is being termed as sky valus stool mass that will happen there. And this is what is considered to be the vrajatya shiram sneho, that is all the sneha portion that is going to get absorbed from the pakvashaya, from the large intestine. Chirat piditamanena dukkham shushkam shakrit. Because of that, the person will be having the very hard stool. So this is responsible for the more amount of pressure on the lower abdomen as well as back. So this is responsible for the more severe pain to the shroni, etc. So, and this is in turn later course, this is responsible for the aswastham hridayam chaiva. How this particular aswastham hridayam chaiva? Because of excess what do you say, that uh, the excessive fecal matter retention, this is responsible for the diaphragmatic irritation. So that's how the person will be having what do you say, the aswasthata of the hridaya, that means just discomfort may be the possible there. As far as upadrava of avarana is concerned, the 5 different upadravas are there. Hridrogo vidradihi pliha gulmu atisara evacha bhavanti upadravaha tesham avrutanam upekshanat. If the avarana is not being treated properly, so this may be responsible for the heart diseases, this may be responsible for pus accumulation, this may be responsible for the splenomegaly, this may be responsible for the chronic abdominal swelling and diarrhea. So I am not going to discuss all these. I would like to say one concept called the splenomegaly. Whenever if there is any kind of the uh, obstruction is being happening, so that is, let us discuss the concept of splenomegaly. What is this particular splenomegaly? Why this splenomegaly happens? What is the relation of this splenomegaly in terms of avarana? So let us say if a person is taking more amount of the alcohol, or if the person is having the what do you say, the more amount of medakshaya from the body, what actually happens is this is responsible for the displacement of all fat from adipose tissue which is present on the periphery into the liver. So this is responsible for the fatty degeneration. And if there is fatty degeneration, what will happen there? So this is considered to be responsible for the hepatomegaly. And the next consequence will be cirrhosis of liver. What is cirrhosis of liver? Cirrhosis of liver is nothing but the shrinkage of liver. Shrinkage of liver in the sense, this is what is considered to be the what do you say, the obstruction, that is what is happening, the portal hypertension. When there is portal hypertension, definitely there will be an avarana somewhere in the liver. And so when this particular portal hypertension, in the sense there will be the backflow of the blood from the portal vein into the superior mesenteric vein and splenic vein. Then superior mesenteric vein, what actually happens is there will be the backflow, and this will be responsible for the, what do you say, that the bleeding per rectum, etc., that can happen. And when there is backflow of the blood to the superior mesenteric vein, what actually happens is there will be either splenomegaly, plus the person may have the esophageal varices also. So this is what is considered to be the avarana that is happening at this particular level, and the outcome is this one, splenomegaly and other even esophageal varices and even bleeding per rectum that can happen. So the take home points as such, the avarana is not a clinical diagnosis, it's a pathological diagnosis. It has two components, one that is avaraka and avrata. Avaraka is the one which covers the channels, so which is leading to the obstruction, or we can say it could be Siraja Granthi there, or Dhamani Pratichaya, etc. That could be that. And that is usually Avaraka is having Murta qualities. Murta qualities in the sense that is the physically visible qualities. And Avrita is the one which is being covered by the Avaraka. And most of the occasions it could be usually Vata dosha that is going to get Avrita there. And what we have learned is just a tip of the iceberg. A lot of things are there to explore. So in terms of the concept of Avarana there. And I'm very thankful to all the faculty members and all the organizers of Nidana Siddhi who had given me the opportunity to speak in front of you. I don't know how far I have reached to all of you, as this was a totally new concept. I would like to put forth to all the delegates here. Thank you. Any queries, etc., you are most welcome.
Thank you so much, sir. Any queries, students? If you are having any queries, please, you are free to put in the chat box. You can keep your mic on and ask directly to sir. Yes. Sir, how can you differentiate between the curve evum? Sir, the question is, sir, how can we do the differentiation between Vaigunya and Srotodushti?
Okay. Sinchana, right? Okay.
Yes.
Actually, so when you look into this, the concept of Kavaigunya and Srotodushti, so Kavaigunya, that is happening as soon as when a person is taking any kind of the Nidana. And Srotodushti, that happens after a certain duration of time. In the sense, if a person is taking, for example, Snigdha Bhojana, definitely, so that will be responsible for the, what do you say, that the immediately Kapha Dosha Prakopa, and there will be Snigdha Guna Vriddhi inside the body or alimentary canal, etc. And so there will be, what do you say, that the Dushya, the Dhatu Dushti as such. That means Kavaigunya. So it actually happens, that is before the Dosha Dushya Samurchana. And Srota Dushti, that happens after the Dosha Dushya Samurchana there.
Sir, the next question is from Suraj. What is the relation between Avarana Mudra Dhatu?
Avarana?
Mutraghata. I don't know the question, sir. Sir, is there any, I think the question is there any relationship between the Avarana and the Mutraghata?
Definitely. So there is an relation itself. When you look into this mutra khata, so mutra vibandho balavan. So that means the vibandha, that is obstruction, will be there, and this is considered to be the prime etiology is avarana itself. So there is an obstruction which led to the mutra khata there. I think I have reached the person. So first of all, any kind of the obstruction, that is naturally, that is what is considered to be the what do you say, that the obstruction, and then obstruction in the sense that is an avarana. So this is further led to the mutraghata there.
Sir, the next question is how Avarana help in knowing the Samprapti and its Vigatana?
Okay. Avarana and samprapti vikatana.
Sir,
For
how does
that you have
how does the Avarana help in knowing the Samprapti and its Vigatana?
for that, if you are able to identify these, the what you say, the samprapti ghatakas, then you can able to identify this very nicely. For that, dosha, dushya, in the sense the dhatu and mala, then srota affliction, sroto dushti prakara, then comes the udbhava sthana, sanchara sthana, vyakta sthana, all these, and then comes the rogamarga, etc. Try to identify all these, then you can able to make the samprapti vikatana properly. So as far as the avarana is concerned, whenever there is the presence of ama in one or other way, so that will be responsible for the avarana itself. On that particular part where ama is there is no movement that is going to take place until and unless if there is ama visha formed there. Ama visha formation, so that will be considered to be straight away, that will be moving from the what do you say, that if there is any obstruction is also there, ama visha formation, that will be moving into the rasadhatu without proper digestion, because so that is what is considered to be having the vyavahi and vikasi guna.
Sir,
So
the next
like that we can able to do that.
Sir, the next question is, sir, can you please explain what is the Swatantra Avarana?
Swatantra avarana, in the sense, basically avarana, anyonya avarana, what we can say, that could be swatantra avarana. Anyonya avarana, that is one particular type of udivata is doing the, what do you say, that the obstruction to the other type of divata. For example, pranavrita vata or pranavrita vyana or vyanavrita prana, etc.
Sir, for Sira Granthi, whether we can directly correlate with thrombus or embolism, or else something else we can compare with the Sira Granthi, sir?
Sira Granthi, so that could be, what do you say, that is actually one of the, what do you say, that is Sruto Dushti Prakara itself. When you look into that, Dhamani Pratichaya, or otherwise it's also called Sira Granthi, that we can able to say the, what we can say, that is, in other words, that is responsible for the obstruction itself, avarana only. What was the question actually?
So the question was whether we can directly correlate the Sira Granthi with thrombus or embolism, or else something else we can also correlate, Sira Granthi.
That depends upon the site as such. That can be even thrombus or embolus. Both the things are possible there.
Okay, sir. Sir, is Dhamani Parichaya or the Sira Granthi the process of Avarana?
Yes, we can say it's a process of avarana itself.
Okay, sir. Any other questions, students? You can even directly ask to sir. Keep your mics on. Very happy to get these doubts. It shows that you have understood the concept. That one question is there. Can please explain what is Swatantra Avarana in terms of Dhatu and Avaraka, sir? Swatantra
In terms of
Avarana in
Dhatu
terms
as
of
Avaraka.
Dhatu and Avaraka.
Okay. Dhatu as Avaraka. So there is no actually Swatantra Avarana. So let me think in this particular regard, because this is a totally a new description to me in terms of Dhatu as Avaraka. Dhatu as Avaraka, usually that could be considered as a Paratantra Avarana itself.
Yes, sir.
Okay, which plays an important role in Avarana, rogamarga, or Srotas.
Important role in, sir, next question is which plays the important role in Avarana, whether rogamargas or the srotas?
Okay. Actually, so these are the two different terms itself. Rogamarga, actually, these are the two different terms. In both the cases, we can say, in both the situations, we can say, but the thing is, the description of Avarana in both the cases is different there. Actually, we are looking into that particular the point from two different angles.
Yes, sir. Yes, sir. Right, sir.
Thank you. Thank you.
Okay. Students, any other doubts? So it's my duty to reach directly students to you. So how they are sending the doubts now, in that manner only I am reading, so that they should get satisfied.
Yes.
Thank you so much, sir. You have explained the concept of very complicated topic, that is the concept of Avarana. You have made it so simple, and with comparison to the pathology, you have explained very nicely, sir.
Thank you, madam. Thank you.
We are very much thankful to you, sir,
Thank
and
you, madam.
thank you
Thank
so
you.
much for accepting our request. Only by when I approached you, sir, you are very down to earth, sir. I like that very much, sir.
Thank you, madam.
So
Thank
many
you.
people have told so many things, but you have approached a very nice approach. It was very nice to meet you, sir, and thank you so much, sir,
Thank you, madam. Thank you.
for sharing your knowledge and precious time, sir. Thank you so much,
Thank you,
sir.
madam. Thank you. Thank you.
So shall we conclude, sir?
Okay, madam. Okay. Thank you, madam. Thank you.
Okay, ma'am. Okay, sir. Thank you.